seconds.
Good evening, all. I, Shreya from Torrent Pharma, welcome you all to the Spine series, a noble endeavor by the team of Stavya Spine Surgeons. Thank you all for taking out time from your hectic schedules and joining us live today. Before we begin the session, let me take you through the legend of Stavya. Stavya literally stands for Lord Krishna, the first spine doctor in the world. He treated Kubja, a hunchbacked woman from Mathura. The legend says that Kubja was once walking the paths of Mathura. She crossed paths with Krishna and offered him sandalwood paste. Moved by her devotion, Krishna treated her and Kubja stood straight. Hence, the legend of Stavya continues. With similar passion, the team of Stavya stands today, helping thousands and thousands of patients lead a better life. The Spine series was an educational effort in the same direction. Today is the eighth webinar of the series for all of us. Through the educational endeavor, the Spine series, Stavya, along with Shelkel, has been oriental in spreading out the roots of knowledge both nationally and internationally. As the challenges pertaining to the spine health arose during these tough times, so did the new possibilities. In an effort to understand the same, we always had an expert panel throughout these series who shared their wealth of experience with us. The Journey of Spine series started long back in the month of August. The first webinar kick-started with the basics of spine. Thereafter, many core topics covering the subject matter were taken up every alternate Thursday. Osteoporosis prognosis and treatment options, lumbar degenerative disease, cervical degenerative disease, ankylosing spondylitis, and advances in spinal surgery were the topics that were touched upon. Today, we welcome you in this month of November to yet another exciting eighth session for Spine series, the quiz session. This quiz session shall be followed by a talk by Dr. Hitesh Modi on how to write an article for publication in journal. Before we begin the program, let us welcome our esteemed moderator for the day, Dr. Bharat Dave. Dr. Bharat Dave is a renowned spine surgeon. Dr. Bharat Dave holds an experience of more than 30 years. He is an eminent speaker at all national and international forums. He is also the reviewer to many reputed journals like the Journal of Orthopedic Trauma, the Indian Spine Journal, the Asian Spine Journal, and the Global Spine Journal. A warm welcome to you, Dr. Dave. Our second moderator for the day is Dr. Hitesh Modi. Dr. Hitesh Modi is a senior consultant pertaining to the minimally invasive spine scoliosis surgery at Zydus Hospitals. He is an honorary spine surgeon at the VS Hospital, NHL Medical College, Gujarat, Ahmedabad, India. He is a PhD from the Korea University, Seoul, South Korea. He has many fellowships in spine surgery from Canada, Hong Kong, South Korea, and of course, Stavya Spine Hospital, India. Warm welcome to you too, Dr. Hitesh Modi. The pattern for today is strictly a quiz session pattern. So without further ado, let me introduce you to our three quiz teams comprising of all eminent emerging doctors. Team A consists of Dr. Vikram, Dr. Nilesh, Dr. Shrikant, and Dr. Kirti Yadav. Dr. Vikram Patidar is a renowned spinal consultant at Advanced Spine Center at Indore. He has specialized himself in minimal invasive spine surgery and deformity correction. He has his fellowship at Stavya Spine Hospital. Dr. Nilesh is working as orthopedic spine surgeon in Curewell Hospital, Indore. He also has his fellowship from Stavya Spine Hospital. Dr. Shrikant is a spine surgeon at Aurangabad. He has fellowship from Stavya and St. Mary Hospital, Seoul, South Korea, fellowship in endoscopic spine surgery from Germany, ASSI fellowship in minimal invasive spine surgery from the Bombay Hospital, Mumbai, and Dr. Kirit Jadhav, who is working as spine fellow at Stavya Spine Hospital, Ahmedabad. Welcome Team A. Team B consists of Dr. Yash Shah, Dr. Ankit Patel, and Dr. Dhruv Patel. Dr. Yash Shah is a consultant spine surgeon who has a fellowship of National Board of Spine from PT Hinduja National Hospital and MRC Mumbai. He has fellowship in minimal invasive deformity correction and lumbar disc arthroplasty from France. Dr. Yash has AO Spine fellowship from and also from Stavya Spine Hospital. Welcome, Dr. Yash. Dr. Ankit Patel is a spine consultant at Fifth Spine Clinic, Orthopedic Spine Surgeon Fellowship. He has been trained across all domains of spine specialty with special interest in motion preservation and minimal invasive technology. Dr. Dhruv Patel is a spine consultant at Epic Hospital, Ahmedabad. He has his fellowship at Stavya Spine Hospital, Ahmedabad. He has AO Spine Fellowship from London, UK, and AISA Spine Fellowship from HSS, New York. Welcome Team B. Team C comprises of Dr. Paresh, Dr. Himanshu, and Dr. Miran. Dr. Paresh is a consultant spine surgeon from Nagpur with fellowship in spine from SSHRI. Dr. Himanshu is a consultant spine surgeon from Sangli practicing and fellowship in MUHS AS Asia Pacific from Germany. Dr. Miran is in PG second year orthopedics and holds a special interest in spine. A warm welcome to you, Team C, as well. Before we begin the program, I would like to mention here that three teams would be competing against each other in a designed pattern of questions which have been formulated by our eminent moderators, that is Dr. Bharat Dave and Dr. Hitesh. The questions are also open to the audience, and the audience can answer these questions with certain rules. The rules are as follows. Quiz will be appearing on the right side of the page below the comment section. Those of you who have logged in can clearly see that. Please select the right answer from the options given. Answer once submitted cannot be undone. This means that you can only answer one question once. After submitting the answer, click on the next button to move on to the next question. If you refresh the page accidentally, last question will appear first. In case of any query related to the quiz, kindly contact on the number mentioned, that is 7021998806. I repeat, 7021998806. The quiz will be active only for 35 minutes. So you can only answer the quiz questions along with the participants. Once the quiz session finishes, even the audience won't be able to go back and answer the questions. Thank you so much. Now I welcome Dr. Bharat Dave and Dr. Hitesh to kindly take over the session and explain to us how the rules for the participants would work. A warm welcome to you all, and over to you, Dr. Dave. Thank you so much.
Thank you, Shreya. Thank you, Torrent, and thank you, Virtual Bucket. Today is the 16th anniversary of the Stavya Operation Theatre. 16 years ago, the Stavya Operation Theatre, they were started. There was the first surgery which was done 16 years ago. So I welcome you all on this sort of novel day. I'm going to share my screen so that we can have the questions and the disciplines mentioned. How are we going to answer? The quiz has been prepared by Dr. Hitesh Modi, active participation from Hitesh, and active participation from Dr. Ajay. Although my physio team has helped me to set the PPT named Biju and Payal. And I'm sure, all this thing has been sort of kept in the loop by Amita as well. So I'm just going to share the rules for team A, team B, and team C. There will be 60 questions. 30-second timer will appear on the right side. Please, I'm sure we all have assigned leader. Team A has the assigned leader is Vikram, Dr. Vikram. Team B has the assigned leader is Dr. Dhruv, and Team C has the assigned leader Dr. Himanshu. So they will be replying privately to Dimple Madam in her chat box, and she will record this answer, and whoever has replied first, if there are all the three correct answers, then the first reply will be given the priority. The capital A, B, C, D, E are written as well as the answer. So you can reply capital A, B, C, D, E or maybe small a, B, C, D, E. First prize from the team, out of 3 team will be given the prize, and they will be sent to you at your home address. In the case the lucky draw of the participant, we will also identify whoever has replied maximum answers, then he will be given the prize as well. So let us start the quiz and let us have fun. This was a novel idea while we were discussing, how to prepare and how to have everybody's knowledge checked and, keep the sort of knowledge, imparting the knowledge. So that is what we were just discussing with the team, Devanand, Shivanand, and Ravi as well. And that is what has come sort of live today. So let's share. And then at the end, afterwards, after the quiz is over, we will have Dr. Hitesh talking about 10 minutes how to publish. And after that, we will have the right and wrong answers confirmed. And then we will have some sort of, the winners celebration as well. So let us start the quiz.
Is it stuck?
Bharat sir, I'm not able to see the next question.
Next question. I think it is stuck.
It is stuck at 5.
Sorry, say that again.
Sir, I think it is stuck. We have not gone to the next question.
Okay.
Yes, sir. Yes, sir.
Yes, now we
Sorry.
can.
Yes, sir.
Yeah, sorry.
I think timer is stuck.
Yeah, okay. हाँ विजय थैंक यू भैया ओके हाँ थैंक यू दोस्त थैंक यू हाँ हाँ बोले लीजिए
Timer is stuck again. Okay. Chalo. Timer is stuck again. Okay.
Yes. D लगी दो ना, D. None is wrong. D.
Thank you very much. Thank you, everybody.
Tension wala
I
काम
think I kept you all tight, and I'm sure you have replied. So let's now move on. I think Hitesh doesn't need introduction. Dr. Hitesh Modi joined Savia when it was in the transition phase, and Dr. Hitesh, only one identification I would say, he has done more than 100 publications, and that is something which is really an inspiring fact. And he is now editor-in-chief of the Backbone Journal as well. Already first volume published, and second is on its way. So hopefully, Hitesh has put the Gujarat and Ahmedabad and Stavia on real big board as well. So over to Hitesh for his talk on how to publish. By the time probably the Dimple ma'am will give us the winner, the team name. So Hitesh, you can carry on with your slide share. Yeah, thank you. You're muted. Huh. We can't hear you.
Oh,
You need
am I
to-
audible now?
No, you're audible, but then you need to have the slideshow.
Yeah, okay, we'll start, I think.
Yeah, that's it.
Okay. So, thank you, Bharat sir, and all doctors. Thank you, sir, for introduction. I am privileged to have I have assisted the first surgery of Stavia 16 years back with you, sir. And it was interesting session. So first of all, we will start with our talk, how to write an article for publication in the journal. So as we know that we have already started by Spine Association of Gujarat, we have started Backbone journal. So everybody is invited and most welcome to submit the research paper, article or anything so that we can publish your study. So first of all, we will think the importance of publication. What is the importance? It basically authenticates your work. It gives you an academic accreditation. It also boosts up your literature review as well as it brush up your knowledge and latest research. It improves your management to the patient, and sometimes it may cause some financial benefit as well regarding promotion and other things. And additionally, as we know that writing is a mode of communication in present world because it shares ideas, it gets feedback and responses, it gives you academic rewards. Published article is a marker of academic success. It gives you promotion and sometimes good professional post as well. But drawback is always we know that it is time consuming, boring, and sometimes little financial rewards. I'm fortunate to declare that my first paper of my career was also from Stavia. I think you, sir, you know that about the Rip-Krebs graph paper. That was my first paper.
Yeah.
So we decided we want to write a paper, we want to publish an article. So we have to remember certain principles, how to write an article. So basically we have to remember what are the parts of paper. So we have to remember the stem read principle. What is that? T is title page, A is abstract, I is introduction, M is material and methods, R is results, A means analysis, D discussion and conclusion. So this is a normal principle, team-read principle, whenever you want to write in any article and submit it into the journal. So we must know what is an ideal length of paper, and usually the title page, abstract and introduction about 1.5 pages. Material and method should be in details about 3 pages. Result should be prescribed very precise about 2 to 4 pages, and discussion is 4 to 5 pages, which is the main part. And if you count the word count in your word, article should be less than 3,500 words and case report should be 2,500 words. So if we want to search before we want to write, so like in a patient of cardiac, we want to search for ECG. Similarly, we want to search something. So we have to identify our subject and search that subject on pubmed.org. And we have to see about the topics. If you want to see about the missed TLIF, means you have to search about MISS, endoscopic TLIF, results, evaluation, complications. There are different topics that we want to search on PubMed. And once you read abstract, identify 15 good articles. And after you identify 15 good articles, read full those articles as a whole, and then select. The important criteria is you have to select 80% of article within 5 years of duration. Then you have to prepare an Excel sheet, note down the differences and similarities compared to your study or your topic in an Excel sheet, so that you don't have to go again and again to that article, and you can identify the differences. And then you have to develop and modify your thought and think about an article, and you can think that what can be published now. So once you identify your topic, you identify the subject, the calculation should be the first. So basically, you have to prepare Excel sheet, charts, you have to see radiograms, other images, and then prepare table, figure accordingly. And then you have to start analyzing your patients. Like you have 50 patients, you want to make it average, age, results, VAS score, ODI, health index score, anything. But first of all, you have to do analysis like lumbar lordosis, incidence, everything. Then you prepare your framework based upon your result and your calculation and test. And then you have to modify again, strengthen your research. You can modify your aims, purpose of study, etc. And then you can start writing. So now you are at a phase that you want to start writing a paper. So when you want to start, you have to start with introduction first, about 300 to 500 words. It is basically consisted of 3 to 4 short paragraphs, where first paragraph explains about the known facts, usually 2 to 3 references. Second paragraph will quote unknown facts or contrast material or your observation with published reports, that this is my observation and this is what is happening. And after that, you make your third paragraph to present a subject that these are all published things, this is not published, and therefore this is our aim of study. We want to present this kind of hypothesis, and you have to question your idea that okay, we think that smoking will decrease fusion rate in TLIF patients, and is it really that thing that we want to develop this study on this base? This is the third paragraph. This is an example that the first paragraph is general, second paragraph and third paragraph will present your aim and hypothesis, like goal of study and other things. Once it is done, you come to material and methods. It should be in detail, usually 500 to 800 words. First paragraph, you have to start with your type of study, like prospective, retrospective, review study, case report, etc. You have to describe your population, what type of population you have selected, age group and everything. And you have to include your selection criteria as well as exclusion criteria in this first paragraph. And in second paragraph, you come to the how did you do the study, like about follow-up, operative, what did you analyze, VAS score, ODI score, what is time frame of follow-up, etc. And you can describe operative technique in a separate paragraph as well. Third paragraph usually is allocated to calculation or sometimes statistical analysis. And you have to mention the relevant part only. You cannot write negative that we did not do this, we did not do this. Only whatever is done, you have to explain that. This is again an example that the first paragraph, then second, operative technique and statistical analysis. This is how to develop your 4 paragraphs. And once it is done, you can present your statistical analysis. Whenever you are writing about statistical analysis, it should be in SI unit. If there is machine used, you have to write about the machine names with scientific parts, where it is made. And if you have done any test, you have to write like PAD, UNPAD, t-test, ANOVA, Kruskal-Wallis, any kind of test, you have to describe it detail. And if you have used software, you have to write down the name of the software as well. Then comes to the result. So this is an example of result, like first paragraph will describe general, second paragraph will be main, and other detail. Like first paragraph will be a general part, average age, number of patient, group, subgroup, everything, average follow-up you have to describe. If possible, you have to write everything with a range of standard deviation. Then in second paragraph, which is considered a main part or main thing of your study, you have to describe stepwise your results and write with statistical significance level. Just write statistical significance, nothing else. And you don't write what indicates, what doesn't indicate, you don't have to write. Then if you continue that, third paragraph will be some additional findings like grouping or subgrouping. If you have made some groups, you have to describe that. Then fourth paragraph will be some unusual finding, like if you have found some complications or some statistical different kind of test or some other things, then you have to describe it into the fourth paragraph. Like this is the fourth paragraph. Here I have described that the 17 complications, 32 points. This is last paragraph usually. And once it is described, then what kind of treatment is done, and then you go to the discussion. The discussion is a main part, usually 4 to 5 pages, around 1000 words. That is very difficult to write. We have to remember that. The first paragraph will shortly introduce your study, conclusion, and aim is fulfilled or it did not fulfill. That's the only thing in first paragraph, about 7-8 lines. And second paragraph, you have to compare your result with the previously published results. So you have to explain previous studies followed by your result and whether it matches or doesn't match. You have to explain them. And you have to give 3-4 good references and which is comparable to your results. Like this discussion first paragraph, and then second paragraph, you start with the result part and compare with your study. Then in third paragraph, usually it presents with contrasting field, like dysphagia after anterior cervical discectomy, but you are producing a result of total disc replacement. Then it is a contrast. It may be possible that it does not have a significant dysphagia. Then you write first some contrasting thing, but you have found some other result. And why did you found? You can explain it. And this is our kind of study, or we have used this kind of implants, and it becomes positive. So you have to make it positive in contrast studies. So this is usually a third paragraph. And fourth paragraph comes to explain about pitfalls or shortcomings of your study, maybe sample size, not long follow-up, other things, blah blah. And then you have to mention at the end, still our study is main, and it gives you better idea, it adds to the publication and research. So that's how you have to write. Then the fifth paragraph, which is like result, unusual complications or some other contrast thing which you have observed, and how did you treat? Give probable answer for those complications and how can be treated. So that is main part. And then last will be a conclusion paragraph, that this study has exhibited and result is favorable or not favorable, like that. And then you can conclude in 4 or 5 statements. So this is very short. Like again, this is showing here, this is a complication here, and at the end, the last paragraph is conclusion part. Once you do all those things, then come to the abstract. Never write abstract before you complete the paper. You have to see a specific journal. You have to see the formatting of that abstract. Write at least write it at the last once you finish the full manuscript. First line is introduction, second is aim and objectives, third is about material and methods, fourth is results. In result, describe number, and number, nothing else. Don't write we found this and that. And then final is conclusion. This is an example of a published paper which is shown here. Important thing to remember is to write references. Whenever you identify 15 to 20 good articles, after that you see more and more inside that, you will make it 25 or 30 articles like sub references. And whenever you want to write a reference, it is always better to use EndNote library. So EndNote will take directly references into your article and you don't have to reorganize again and again. EndNote is always better. Always choose 15 articles, then supportive articles will add on and it will make up to 25 to 30. Then legend for figures will be at the end, and it should be described very well and it should be in order. Figure 2 cannot come before figure 1. So it should be like that. Don't write too long sentences and give abbreviations at the end. Always write the same thing, whatever you are going to write in the figure. Tables always should be prepared in Word file, not in Excel sheet. Write with a standard deviation. It should be clear title. At the end, it should have abbreviations and it should have specific format. Like this is a wrong format, which I have shown here. While if you see any journal, this is a correct format which is shown below with abbreviations below. If this is another example, this is a correct type of format whenever you want to publish a table. Don't make boxes at all those things. Only this is enough. If you want to submit figures, then not more than 5 figures. Should be very precise with legends like written properly. It should be in JPEG or TIFF format. It should not be in the Word, and high resolution image is always better. And then write legends properly. Like this is another example of figures with a legend and figure upstairs, figures and legend here. And then you come to title page. Title page will conclude title, short running title, name of authors, institution, declaration, word count of paper and corresponding author's details. Only one page is enough for the title page. Like this is an example which is wrong, like all author's detail, this is wrong. If you see this is correct format. Only one page, name, all authors, institution, everything is completed and done. So this is a perfect format for title page. If you want to see about the authorship, it is a red hand rule. First author should be first, who has done the maximum job. Corresponding should be last or second if he has done more work. Whether seniority or juniority, who has done more work should be the first author. Usually we should not use more than 5 authors whenever we are writing author's name. And then C for the journal. There are specific journal for specific topic. I cannot submit minimal invasive spine surgery topic in an open surgery. It is better to find out minimal invasive surgery journal or a broad spectrum journal. See impact factors of the journal, quickness and of the responses of the publication, uploading feasibility on online, and also evaluate strength of your own paper. If it is a very low strength, several articles are published and you want to publish in Nature, that's difficult. Then before you do submission, there should be some search and some review. Always do proofreading, language check, self-review, ask somebody else to give comments and suggest something else, then revise before you submit. Once you review it properly, thorough revision is done, then you can take help of agency or organization and then submit. Now most of the journals are having online submission. You can open the journal site, register yourself. If you are not registered, you can submit according to the submission requirement or the guideline, and then finally approve your submission after checking the PDF and then save for future prospectus. Then once you have submitted, revision is always very common thing that you get. It is never personal, it is a routine thing. And acceptance of paper is usually impossible without a revision. So don't delay for revision. When you get revision, do it immediately. respond to all reviewers' comment with editor's comment, make necessary changes and mention them with yellow or whatever color you like in highlight. And if you don't want to do any change, you have to explain why you can't make change. You can suggest in detail to editor. And once it is done, even if the paper is rejected, you have to see and follow the reviewer's comment, improve your paper again, resubmit with another journal in low impact factor. Rejection is not also uncommon, it is very highly possible. So this is the last slide. What is the fate of rejected papers? 70% of the rejected papers get published in other journal with low impact factor of specialty journals within 5 years, and 50% of rejected papers in specialty journal get published in another specialty journal within 4 years. So never get discouraged, because the chances of getting publication is very, very high once you write a standard scientific paper. So I will give you best of luck and you can start writing, and I will request to submit your valuable paper to Backbone Journal. Thank you.
Thank you very much, Hitesh, for an excellent talk, which was real brief and eye-opening. And I'm sure, you know, those who have done the work at Stavia, they know the data keeping as well. And that is something which is very important in order to write something. So now we move on to, I think the team C has got 39 out of 60. Team A and Team B has got 38 out of 60. So nearly the same. So 39, the Team C wins. That is one. Second thing. Yeah. Second thing.
I think the X factor was Miran.
Yes.
Yeah. Fastest has been Team B. Now the time to display answers. Are you all okay to display answer? Because
Yes,
we
sir.
have now, you know, time wise we are 9:08. Are you okay?
So
Shall we
we
answer
like to know
answers?
where we have gone wrong.
Yes.
Yeah, okay. Okay. Then I'll share the screen. Hitesh, you need to stop your screen.
I have already stopped screen share, sir.
Okay, okay, okay. The first answer was anterior intraosseous nerve.
Yes.
I'll move on. The second answer was decreased distal sensory amplitude. So the nerve conduction study, the first thing that shows. The third answer was recovery is seldom complete in acute compressive episodes. So whenever there is neural compression, then answer 4 is primary pathology effect, decrease in the disc height. I think it increases the loading on the facet joints. Answer 5, this was a Morquio, glycogen storage disease. This girl presented just few days ago in the clinic. She was 1 year. Low back pain. I think most of us still we do not know. And I still consider pain is the biggest invisible monster of the earth. I still have failed to understand what is pain, in spite of so many years of the practice. Most common direction of symptomatic herniation lumbar disc is posterolateral in the lumbar, and it is foraminal into the cervical. I'm sure everyone is aware of this. Posture associated intradiscal pressure. I'm sure it is 275 when you sit and flex and lift weight. First fellow was Dr. Arvind Gosai. Limbus vertebra. I'm sure it is all known fact. This is not a fracture which is often reported by many as a fracture. Who is the most, the most important decision maker? I think it is the patient. And nowadays, because of the things available on the tip of the finger, patient comes with the sort of lots and lots of questions, and they are the one who decides and who drives us how to treat. And that is where we often use the tomophilia and tomophobia. Tomophilia means those who are pro surgery, and tomophobia means those who are pro against surgery. And these two groups we really need to identify. This is AVM, avascular arteriovenous malformation, which is quite obvious with this small punctates into the canal. Traversing nerve root, I'm sure that is L5. Double crust syndrome, I'm sure everyone knows, CTS and 5-6 PID. This is very important. I think it is so good. You can say that it is epidural lipomatosis. You can see that there is no nerve root seen and it is all compressed all around by the fat. So it was epidural lipomatosis. Has to support the head. I think it was C1, C2. This lady had C1, C2 tuberculosis. Again, it is sarcopenia. You can see hardly any muscle. It is all fatty infiltration. And this is an emerging term. Well, it is already an established term, but this is something that goes with osteoporosis. So sarco-osteoporosis. My next talk on the Ortho TV on this Saturday. It is on this sarcopenia, osteosarcopenia. I'm sure everyone knows this. Survival, this was Duchenne. Survival beyond 30 years of age is less likely. This is again, I'm sure we all practice the same. Neurological deficit is not likely to be reversible by surgery. And we have to really stress this to the patient so that, they all know that what to expect and accept after surgery. Paget's disease, I'm sure it is all known. Tesla, it was Terra Electrovolt, and it was Nikola Tesla who was the physicist.
Trickiest question of all, sir.
Yeah.
Nilola, most of us.
That's right. Yeah, Nilola. Yeah, that's true.
It's very tricky.
And I think you can see who has done this. It's Sajay.
Nikola Tesla was an assistant with Thomas Alva Edison.
Yeah. The uncredited genius.
Yeah. I think this goes hermit sign. This is again hypertrichosis. We were just debating whether everyone would know the word hypertrichosis. And at the end, we conclude that we do not want to, use that. So it was spinal dysraphism. And I'm sure everyone is aware, number of curves plus 1, that gives resistance. So it's 10 times resistance bearing capacity than a straight fixed structure like femur. So that's what the spine is. It's such a structure, which gives us lots and lots. So this was biopsy and confirm. I'm sure everyone probably would agree to that. And we have 2 OAM suits so that that makes life easy. The purpose was only one: if one gets non-functional, what to do next. So that was the reason why we have most of the time two things: operative management. And establish and confirm the hemodynamic. I'm sure that is very, very important and crucial to do in quadriplegic patient who has come to us in 4 hours. We really need to restore the blood pressure. And radiological, I'm sure everyone is aware of that. Pelvic incidence, that is the fixed parameter. And it was the S1. Don't get surprised if you find something which is sort of, patient keeps coming to us and it is now the trunk which is fixed at the foramina. And that was Hitesh chi-square test. This is again very well known: decrease in the heart rate and decreased blood pressure, neurogenic shock. That was osteoma. I'm sure everyone is aware of that. It was pointing to that only with the aspirin pill. And this was few days ago, arthrogryposis in the clinic. I'm sure it goes without saying it was prostate sclerotic lesion in a male. And I'm sure this is denosumab, because it was all patient had past history of carcinoma where you cannot give teriparatide. And it was -3.6, so you need to give something superior. Patient had alendronate already given, so that's why I'm sure this is myelomeningocele. All other 3 can cause neurological deficit. This is again, answer is A, hemivertebra. Not C, because it's incarcerated. Yeah. And I'm sure we all are getting bothered. Now the Gujarat has got the night curfew from 9 p.m. to 6 a.m. Ahmedabad is studded with COVID cases, and all the private as well as the government hospitals, they are full with COVID cases, sick patients. So that's today's declaration from the government. And I think it was Karnataka. And it is to be given 6 monthly for 10 years. So that is denosumab. I think that has changed the practice as well. And it can be given to patients who have malignancy without major side effects. But if you stop and if you do not continue, then the BMD will stop and patient will have increased risk of fracture. So you have to stress that you have to continue for 10 years. Put an alarm in your mobile so that you continue keep taking denosumab every 6 months. This is too good. Sorry. This was Pancoast tumor. Can you? I'm sure you can see that in the coronal images. That is lesion which is face occupying into the upper left, and patient was a smoker. And this is a cheater. This can mimic anything. So one has to be really aware. And this patient had weakness into the hand. This is again answer C, teriparatide first to fill the pot up, because we know osteoporosis can be described as the pot which is empty, vacant or rather empty, and you really need to fill up with the osteoblastic activity, and after that you stop dripping the water, meaning stopping the sort of blunting the osteoclast. So that could be done by denosumab or the bisphosphonate. The pedicle. This is again Ajay's pet question. Roy Camille. And lateral spinal stenosis, A and D. It was Putty in 1927. Spinal luxetta. This is very important middle age for deformity of the spine. I'm sure you may have done Google search while waiting for the 30-second. A patient seeks care for common neck pain. I think 50 to 60%, maybe some may say that 70 to 80%. What is the principal role of spinal ligament? I think limits spine motion. I think all are true, but you need to select one which is the most appropriate. So that was again, sort of a bit challenging as well here. This is quite common, superior end plate, where you will say the load transfer. This is very important. I think good outcome. So if it decreases by 18 or of 18%, then you can say that ODI has improved and it's good outcome. We have in ODI in Gujarati as well. So I'm sure you can have in your own language, and we check ODI practically for all the patients who undergo surgery. We'll say Newman and McNabb classification. The most frequently used classification today. Yes, I'm sure you all are aware of autonomic dysreflexia. The questions were put a bit arbitrarily. You can see that A, B, C, D, E, and then none of the above. This was purposefully done as well. So in order to keep you all, sort of, yes, keep going. So autonomic dysreflexia is something, a patient comes to us with severe headache and he is paraplegic, mainly high paraplegic, then it is autonomic dysreflexia, which is the imbalance of the sympathetic and parasympathetic system. And patient will have severe perspiration, and you need to treat the cause, meaning either urinary infection or bowel loading, something like that in the paralyzed area. And that can even give rise to hemorrhage as well. So, brain hemorrhage. So blood pressure will be around 200, maybe 250, and immediately should be treated with nifedipine. Which one is the following statement? Proteoglycan, they are hydrophobic. Osteoporosis, we do see in the clinical practice when it is a biconvex, the codfish vertebra, the bulging of the disc goes into the vertebral body. Which of the following muscle decrease spinal compressive load? It is transverse abdominis. This is very important. Inability to work becomes a major serious spinal disorder. That's very important. I think none of the other, you can say that symptom red flag, not a red flag. Which of the statement? I think one of you were speaking on the mobile. I think it was Yash. Write down none of this is wrong. It was already all. And the last question is based on vitro testing. Which is the following statement is true? Posterior instrumentation unloads the treated segment.
Okay.
So thank you everyone for participating, and anything else you want to say? I think Ajay, you want to say anything? And Hitesh, you can unmute yourself and speak something if you wish to.
So just a request, if you could announce the audience winners as well.
Yeah, is it in my chat box? Just a minute.
Yes, sir. I've shared on WhatsApp, sir.
Yeah. Oh, yes. It is Jigar who is the winner. Jigar, thank you very much, Jigar. Are you? Thank you, Jigar. He has scored 25, and I think Gayadhar, our own fellow, he has also scored 25. So both have got 25 marks. Gayadhar is from Bhubaneswar and Jigar is from Ahmedabad. So thank you both. I think team C and both Jigar and Gayadhar both will get, the prize will be delivered to you at your homes.
Thank you, sir.
So thank you very much for participating. Hitesh and Ajay, would you like to comment, Ajay?
Yeah, it was good. Everybody participated and well done. It was more simplified, but everybody is interested. We can keep this frequently, and it would be a good way to learn new things which will never come in normal conference discussions.
Yes, sir. Absolutely.
So we can keep something like 30 questions and we can go through. So it's a shared knowledge amongst ourselves. So
yeah.
At the same time, the fortnightly meet will be another thing which we can casually have and keep involved in each other's development and keep motivating each other.
Yeah, I think next meetings are going to be announced by Ravi and Mirant. They both are going to coordinate. Ravi, do you want to share? Ravi, can you unmute yourself and talk? Okay, the next second and fourth Thursday, 8 p.m. to 9 p.m. The second Thursday of December will be done by Himanshu, the case presentation. So we have the interesting case series, and we will have 3 or 4 case presentation, and I'll bring in one of the allied faculty, like urologists, psychiatrists, rheumatologists. So they will give 10-15 minutes of talk as well. So that will also add on our knowledge. So after the interesting case presentation by Himanshu on 2nd, and I think Shrikant has agreed for the 4th Thursday of December. So both will be on board in December. We will have the 2nd and 4th Thursday interesting case discussion. I think maybe till maybe few months or maybe whole year. We'll continue to do so, and I will share the link. Hitesh, would you like to say anything?
Yeah, thank you, sir. First of all, thanks to everybody to take a participation, and Happy New Year to all of you. And we wish that you progress more and more and be prosperous in academic field as well. So my main thing and main request to all of you to participate in academic activities as well as submit your research paper to our journal. We want to make it very successful and make it PubMed indexed as fast as possible. And our aim is not to criticize or not to do anything against anybody. Please, whatever you write, we are here to help you, and we want to publish any kind of study related to the spine or general information regarding spine. Like if somebody wants to publish about patient-doctor relationship in spine patients or general management of spinal injury patient, you are very welcome to write down. If you cannot submit to the journal website, you can directly submit to the email which is given in the website at editor, and we want to make everybody on PubMed list, right? So this is our aim, and we keep continue this kind of format again and again repeatedly twice in a month, and we don't want to stop. Thank you, sir, to give me opportunity to present some
Thank you.
small talk. Thank you.
Thank you.
What is the name of your journal? Sorry.
This Backbone Journal.
Backbone.
You can search on www.backbonejournal.com. You will get the first issue which is published online. We are trying to get it print also. We have already ordered for print, and we are going to spread it across all our orthopedic as well as spine friends and our fraternity.
Ravi, would you like to say anything now about the coming? I have already announced, but you may repeat that, please.
Yes, sir. Just I want to add that in advance we would be just discussing to confirm what are the cases, so that we get different variety of cases which we can discuss among each other. There will be a good discussion. Of course, repetitions also are okay, because then every case is different. Something different would be discussed in every case. So yes.
Okay, thank you very much. I think Shreya, you can conclude now. And thank you everybody for active participation. And I hope this time 8 to 9 is okay for 2nd and 4th Thursday. So please do, spare yourself and spare 1 hour. It will be interesting spine case discussion. And we will have the maximum participation from all of us, please. Thank you. Over to Shreya, please.
Thank you so much, sir. Thank you to all our wonderful participants for this interesting quiz session today. Thank you, Dr. Hitesh, for this fantastic, knowledgeable session. It was a great learning for all of us. Thank you to all the audience for joining us today on this Thursday evening. The Spine series Knowledge Carvan shall continue. These recordings are available on YouTube, and we shall also be circulating the link post the webinar to all of you. You all can subscribe to Stavya channel on YouTube and Facebook page for regular live updates. Today was the 8th webinar of the series for all of us. Shelcal feels immense gratitude to all of you. A warm thank you to the entire Stavya team for giving us this opportunity to contribute to your noble educational endeavor, that is our Spine series. Our guest of honor today, Dr. Hitesh Modi, and lovely team comprising of Dr. Vikram, Dr. Nilesh, Dr. Kirat, Dr. Yash, Dr. Dhruv, Dr. Ankit, Dr. Paresh, Dr. Himanshu, and of course, Dr. Mirant. Thank you so much, Dr. Shivanand, Dr. Ajay, Dr. Devanand, Dr. Ravi Ranjan, and of course, Bharat sir. It has been such an honor for all of us. A special thanks to Mr. Biju, Ms. Payal, and our beloved Amita ma'am for their tireless efforts throughout the series. They all say that the most beautiful thing about learning is that no one can take that away from you. And that is what Stavya Shellcare Spine series has given all of us. Thank you so much for this wonderful series. Good night to all of you and stay safe.
Thank you. Thank you.
Thank you, sir.
Thank
Thank you very much.
Thank you, sir.